Depression or stress or anxiety can be a baseline factor leading to increase in the steroid and chronic stress hormones in your body, which can lead to diabetes. So depression or psychological stress can be the reason for diabetes, and it also can be the diagnosis and the treatment involved in the management of diabetes can also lead to stress. That means somebody knowing that I have diabetes can become stressed even if he is not stressed at baseline, or somebody who has been given medicine for diabetes, which can include tablet or insulin, can become stressed about the management of diabetes. Somebody who needs strict control on diet, that can lead to stress related to diabetes. So it is very important to understand, which your doctor would be the best person to understand, कि psychological stress is the baseline thing that is going and leading to diabetes, or it is the diabetes, its diagnosis, its treatment, diet patterns, exercise requirements is causing stress. So I'm going to give you an example of my patient who is around 60 years old and recently had coronary artery bypass grafting, that what we commonly called as bypass. आणि ते झाल्यानंतर uncontrolled diabetes for so many years, not following with the doctor, and suddenly came to the hospital with acute cardiac ischemia, what we call as heart attack. And the diabetes was uncontrolled and the patient had to undergo a surgery. आणि त्यानंतर त्याला दिवसातून 4 वेळा इन्सुलिन, ही जी डायबिटीसची थिओरॉटिकली बेस्ट मॅनेजमेंट आहे ती दिली. अँड देन दिस पेशंट केम टू मी आणि ही जस्ट स्टार्टेड क्राईंग इन फ्रंट ऑफ मी की मी दिवसातून 4 वेळा इन्सुलिन घेऊ शकत नाही, मला दिवसातून 4 वेळा ब्लड शुगर करता येत नाही, त्या गोष्टीचा मला इतका स्ट्रेस येतो की ज्यामुळे मला छातीत दुखते. नाउ दिस इज समथिंग विच इफ वी अंडरस्टँड ऑन टाइम, it can be very easily corrected. Either the regimen can be changed, insulin कमी करून टॅबलेट देता येऊ शकतात, or the patient can be made more equipped to handle the regimen. That means की इन्सुलिनची भीती घालवता येते, ग्लुकोज मॉनिटरिंगची भीती घालवता येते, इन्सुलिन चेंज करता येतं, दिवसातून 4 वेळापेक्षा दिवसातून 2 वेळा इन्सुलिन देता येतं, एकदा देता येतं, आठवड्यातनं एकदा देता येतं. So there are different regimens that can be suited to the capacity of a patient to understand and then accept that kind of a regimen. So इथे काय झालेलं आहे, पेशंट अगोदर स्ट्रेस्ड होता आणि म्हणून त्याला डायबिटीज झाला आहे आणि म्हणून त्याला हार्ट डिझीज झाला आहे, ही गोष्ट आता अंडरस्टँड करणं अवघड आहे. मे बी इन द पास्ट द पेशंट वॉज स्ट्रेस्ड अँड बिकॉज ऑफ विच ऑल दिस हॅज हॅपन्ड, बट राईट नाउ द कंडिशन इज की पेशंट इज स्ट्रेस बिकॉज ऑफ द ट्रीटमेंट ऑफ डायबिटीस इटसेल्फ. सो जर आपण ट्रीटमेंट चेंज केली तर ह्या पेशंटला डेफिनेटली ट्रीटमेंट चेंज करण्याची आवश्यकता आहे. सो आम्ही पेशंटला ट्रीट त्याच पद्धतीने केलं. पेशंटला दिवसातून 4 वेळाच्या ऐवजी दिवसातून एकदा इन्सुलिन दिलं आणि उरलेल्या त्याच्या इन्सुलिनच्या ऐवजी त्याला टॅबलेट्स दिल्या. द पेशंट एक्सेप्टेड द ट्रीटमेंट व्हेरी वेल अँड देन द ब्लड शुगर केम अंडर द कंट्रोल, हिज हॅपीनेस कोशंट इन्क्रीज्ड, the distress that was caused because of diabetes was reduced. Now बघताना आपल्याला गोष्ट खूप छोटी वाटते आणि आपल्याला असं वाटतं की अरे आपण आपली चूक डायबिटीस वरती ढकलतोय का, तर तसं नाहीये. बेसिकली डायबिटीस डायग्नोसिस इज अ बिग ब्लो. बऱ्याचदा असं पण होतं, यंग जनरेशनची मुलं येतात 30 वर्ष 35 वर्षामध्ये, डायबिटीस डायग्नोज झाल्यानंतर दे फील लाईक द लाईफ इज शॅटर्ड. नाउ आता इथून पुढे माझ्या डाएटवर रिस्ट्रिक्शन्स येणार, माझ्या एक्सरसाइजवर रिस्ट्रिक्शन येणार, मला औषधं घ्यायला लागणार, मला जॉब व्यवस्थित करता येणार नाही. देर विल बी सर्टन कंपनीज दॅट विल रिजेक्ट मी द जॉब, देर विल बी सम इन्शुरन्स कंपनीज दॅट विल रिजेक्ट मी द ऑफर. So all this can create a lot of stress. So there is no doubt that the baseline stress that causes diabetes needs to be tackled, needs to be dealt with by meeting a psychologist or psychiatrist as and when required. But what I wanted to speak about in this video particularly is to increase the awareness regarding diabetes distress. That means the distress or psychological burden that diagnosis and the aspects of its management creates in patient's mind. And for this, what is required is to talk about your problems with the doctor. Talk about what is not going right with the diabetes regimen that has been explained to you. Talk about कि this is the problem. I am not able to take the tablet before meal. Maybe the doctor would be able to tell you a tablet which can be taken after meals. Talk with that. I can't take it in the afternoon. Maybe the doctor will change it to the morning and evening. Talk about that I'm scared of taking the insulin. Either the insulin can be changed or you can be taught about how to take insulin that will not make you scared about it. So what we need to take today as a thread and as an important aspect of management of diabetes is the distress that the diagnosis and the management of diabetes causes. And if we deal with that, a great burden of psychological stress comes down. And I have seen patients' blood sugar, which is otherwise very difficult to get control, suddenly goes down and becomes normal just by removing that small aspect that is going wrong in the management of diabetes. So that is what I wanted to discuss today. That do not get stressed because of diabetes. Whatever is your problem, it is a lifestyle disorder and it will stay there for lifelong. That doesn't mean you have to be on that medication, that kind of diet, or that kind of injections forever in life. As life changes, the lifestyle can also change, and lifestyle related disorder and its management can also change. The medicine can be increased, they can be reduced, the diet can be changed. If you're not able to follow the diet that has been advised to you, it can be changed, it can be adjusted according to your lifestyle, it can be adjusted according to your schedule. Exercise can be managed in your busy schedule also. So rather than being distressed about diabetes, talk about these problems with your physician and de-stress yourself to manage your diabetes.